I'd say the data here were somewhat incremental, but they're important because they are going to change treatment practice as soon as tomorrow. And the reason for that is the data presented here were the Keynote 42 and the Keynote 407. The Keynote 42 was interesting. It was looking at pembrolizumab versus chemotherapy, patients with 1% or more PD-L1 levels. And that was a positive trial with a hazard ratio of 0.81 across the board. So that tells you that in anyone who has any PD-L1, you're better off giving immunotherapy versus chemotherapy. However, when you dissect the trial out a little bit, as was presented, in the high group, PD-L1 50, the hazard ratio is 0.65, 0.66, maybe a little higher. But in the low group, 1 to 49, I believe the hazard ratio for survival was 0.91. So it's telling us that most of the benefits being driven in the high group. So the way I take this is another endorsement for immunotherapy. Certainly every patient with PD-L1, at least 1% should get it. Certainly they could possibly get it instead of chemotherapy, but I'm thinking that the low group probably you'd want to consider a combination. And we just so happen to have a combination trial presented here as well, the Keynote 407. And in that trial, looking at carboplatin and taxane with or without pembrolizumab across all PD-L1 groups, high, medium, and low, the hazard ratio was in the 0.6, 0.7 range. So it looks like now in squamous cell cancer, we already knew that in non-squamous cancer, Keynote 189, that those results were true as well. So I think what we're going to leave ASCO with is combination immunochemotherapy.